Let us start with the general physical examination. This includes the vitals first of all, the pulse, blood pressure, temperature and the respiratory rate. And among the pulses, the different arteries which can be palpated. These include the radial artery, ulnar artery, and then we can follow the sequence. For palpating the radial artery, the hand should be slightly pronated and wrist slightly flexed. Place your three fingers over the radial artery and feel and note down the rate and concentrate on beat to beat interval, whether this is regular or not. You can feel the ulnar artery between the tendons as well. Then, if you have to feel the brachial artery, place your thumb above the cubital fossa on the medial side of the arm and then press slightly and you will feel the brachial artery. To palpate the carotid artery, place your thumb just below the angle of the mandible and feel the carotid artery. Similarly on the other side. Then you can feel the femoral artery, and to feel the femoral artery and to avoid the embarrassment of the opposite sex, never place your fingers directly over the femoral artery. First place your First place your hand over the greater trochanter or the hip joint. Bring your thumb just below the inguinal ligament and press it and you can feel the femoral artery easily, and then you can place your fingers. Never place your fingers directly over the artery. To feel the basic principle to palpate the artery is that always feel it over a bone, then it will be easily palpable. The dorsalis pedis, for the dorsalis pedis artery, place your fingers in the first web space and bring it proximally, and then feel the dorsalis pedis artery. Posterior tibial artery should be felt between the medial malleolus and the heel. Midway between the two, over the bone, feel the artery. So this is the place to feel the posterior tibial artery, not behind over here, behind the medial malleolus. So these are the different pulses and how you feel them. When you take the pulse, there are few things related to the pulse. One is the rate, second is the rhythm. Rhythm is regular if the beat to beat interval is regular. If beat to beat interval is constantly changing, then this will be called the irregularly irregular pulse. And whenever you feel the irregular pulse, you should immediately note down the heart rate and should note what's the difference between the heart rate and the pulse rate. The heart rate will be higher and the pulse rate will be less compared to the heart rate, and the difference of the two is called the pulse deficit, which is commonly you come across in patients with the atrial fibrillation. So after this regularity, there might be regularly irregular pulse, meaning thereby that there might be an ectopic beat or an extrasystole coming after 3 or 4, or there will be a long pause after a beat, this extrasystole. So then it will be called the regularly irregular pulse. After this regularity, you also note that was there any change in the pulse with the respiration. There can be two types of changes in the pulse with the respiration. One is that the pulse rate might increase at the end of the inspiration and slower at the end of the expiration. This is sinus arrhythmia. Then you also note whether the volume of the pulse is how much. Is it average normal? Is it low or is it high? Never use the word good or bad for the pulse volume. If it is closer to the average pulse volume you commonly see in the majority of the patients, then it will be called the average normal pulse volume. But if it is low, you will say that it's a low volume pulse. Then if it is high, then if the pulse volume is high, then you need to see it for the collapsing pulse. And what is a collapsing pulse? For that, you need to place the distal part of your hand or the palm over the radial artery like this. Grasp it with your hand and tighten your grip gradually so that you are able to feel the pulse with your hand. And when you are able to feel the pulse with your hand, do not release the pressure, maintain that pressure, and then lift the arm vertically. Feel whether the pulse volume increases or not. If the pulse volume increases on going up and making it vertical, and then it also decreases when you bring it down, this is called the collapsing pulse. Collapsing pulse doesn't mean the pulse disappears. So this is to be kept in mind. After the pulse volume, you note down the characters of the pulse. Is it of normal character, or is it of pulse is having some anacrotic or dicrotic pulse, which you can only appreciate if you repeatedly see the patients with the valvular heart diseases. Then at the end is the vessel wall. To feel the vessel wall, you place your